I'm Bob Kyle. I'm professor of medicine, laboratory medicine, and pathology at the Mayo Clinic in Rochester, Minnesota. As all of you know, this has been a very busy and a very active meeting with many presentations and many posters. To me, one of the most important presentations was the large study in which patients were randomized to receive melphalan and prednisone orally, which is and has been the standard of treatment of multiple myeloma for many years. The other regimen was the melphalan and prednisone in the same dosage, but these patients also received bortezomib or Velcade. The complete response rate in those patients who received melphalan, prednisone, and bortezomib was 35%. This complete response is a very impressive figure and one that compares favorably with those that we obtain with autologous stem cell transplantation. This, I think, is an important finding. On the downside, there is a problem in side effects. Sensory motor peripheral neuropathy is a common side effect of the administration of bortezomib, and this can be very, very troublesome for patients. In this particular study, peripheral neuropathy occurred in a significant number of patients, but in most of them it did improve when the bortezomib was discontinued. Another promising combination is the use of lenalidomide and dexamethasone for treatment of patients with multiple myeloma. One particular study was presented by Dr. Vincent Rajkumar, in which he updated us on survival in these individuals. The other important part of Dr. Rajkumar's presentation was the statement that patients received the dexamethasone at weekly intervals rather than the conventional days 1 to 4, 9 to 12, and 17 to 20. With the weekly dexamethasone, the patients were able to tolerate it much more easily than they did in the conventional fashion. Also, the side effects were also significantly less. There have been a number of new agents that have been mentioned at this meeting, particularly early phase 1, phase 2 studies. It's too early to know how much benefit they will provide for the patient with multiple myeloma. I suspect, however, that these agents will probably be used in conjunction with the novel agents, thalidomide, lenalidomide, and bortezomib that have been developed in the last decade. This is a time to be optimistic in the therapy of multiple myeloma. I have personally seen more activity, more advance in the last 10 years than I have in the previous 3.5 decades. So this is a very, very important and significant a time for the patient with multiple myeloma.